Hey, welcome to another episode of Tech Talk. I'm your host, Jeff Hootselle. I'm the Chief Cloud Officer with AuditMax. As you guys know, Tech Talk is a show. We talk to people in the world of technology from all around the country. They're doing some really amazing things. We want to talk to them and highlight them and hear about just what's happening in their world. We've always got great guests. Today we got a fantastic guest. Deepti Pandita from Hennepin Healthcare is going to join us. Hennepin is the largest safety net hospital clinic system in the state of Minnesota, and they're really committed to caring and serving for the marginalized and underserved population, which is, as you can imagine right now, the pandemic is a great thing. So, Deepti, we're glad to have you in the show. Welcome.
Thank you. Thank you for having me.
So, Deepti, maybe from the beginning, just tell folks a little bit about Hennepin that maybe aren't familiar with you guys in the organization.
Sure. So Hennepin Healthcare is in the heart of downtown Minneapolis. We are the largest safety net hospital clinic system in the. We serve predominantly people that really cannot be helped anywhere else. Populations that are on state assistance, the homeless populations, people that are incarcerated. And then the other population at large that lives and works in downtown Minneapolis.
Yeah. So first of all, big thank you to you and your staff for everything you guys are doing. I know it's the healthcare workers and frontline workers. We can't say enough of all the efforts you guys have put in and things you're doing to help serve the community. So thank you, for that.
Thank you.
Talk a little bit about it. We've talked a lot over the past 6 or 8 months with other guests on the show of what this has been like with everything with the pandemic that's happening and how they've had to shift. I know you guys being in healthcare, you've felt that as well, and a lot of healthcare organizations have made that shift to telemedicine, which I think you guys have done. But you guys have seen some other kind of unique challenges because of the folks that you serve. Can you talk about that a little bit? What that journey's been like for you guys?
Yeah, it's actually been a steep learning curve for us. So like everyone else, especially with my role as the Chief Health Information Officer and also a clinician, when the pandemic hit, the worry we had was, okay, we shut down our ambulatory systems, but now we have distanced ourselves from our patients. And the solution everyone was talking about was telehealth. And we went with the flow. We had a very limited telehealth footprint prior to the pandemic, and we went full scale from 0 to 100% within the span of a few weeks. What we learned quickly after we had stood up telehealth is that telehealth is not a one-size-fits-all solution. And you would think that the challenge is digital literacy of the patients. And what we found was that that's actually the lowest hanging fruit. Most people have a device or have the desire to connect with their providers. It's the other factors that come into play. So they may not have functioning broadband or Wi-Fi. They may not have, they may have a language barrier. So if we set up telehealth instructions in English only, they don't know what to do with that. Or how do you pull an interpreter into a telehealth visit to have a more streamlined experience? So those were some of the challenges we had to circumvent, and we had to go back to the drawing board to solve for them one at a time with some very unique solutions.
Yeah, and you talk about unique. You guys really just didn't sit back and kind of make the telehealth thing work. You guys also went out into the community as well, correct? And you talk a little bit about that.
Right. So right at the beginning of the pandemic, we did a community needs assessment survey, and this survey was targeted specifically to those marginalized populations. And we asked them, what are your needs at this time of crisis? And yes, some of their needs were more around social determinants. They were worried about housing and getting medications. But then when it came to the specific questions around access to healthcare, more than 80% said that they would like to access healthcare in a virtual fashion, but their challenges were more around, being able to connect to their doctor in the language that they speak, or being able to connect with their care provider who they regularly see. So those were some of the challenges. Very few actually voiced lack of technology as a challenge, as a unique challenge in itself. And majority were ready to embrace virtual care, which was very encouraging.
Yeah. And you guys have done some stuff with the school systems as well, and I think even using the libraries and things like that. Why did you guys choose that strategy, or how did that work in kind of your overall mission?
Right. So the other challenge we had when we talked to our patients was the lack of privacy. So virtual care, as you can imagine, you need to be in front of a smart device or a laptop. And there are families who have 4 or 5 people living in a one-room apartment and cannot find the privacy there. So what we did was, okay, could we set up sort of a spoke and hub model where the patient comes into a space where they can have privacy, they can have access to a laptop, such as the public library, or we also have a coordinated care center where patients with unique needs get their healthcare in a coordinated manner. And we said, okay, if you can come into this center, we will give you a private space, and then our providers would be available from any place or any site to have consultations with those patients. We also did something with the school system where we engaged the school health services and said, if a teen or an adolescent needs a private consultation with their pediatrician, could they use the school computer, go into the school space, and get privacy there?
No, that's great. Yeah, and now everything's shifting. Now, thankfully, as we go into 2021, we're starting to see the vaccines be approved and starting to get deployed and rolled out. I know that presents a whole nother set of challenges. As you look at this and look forward into 2021, what do you think we're going to learn from this? Every time there's an event like this, it's always really hard to see the forest from the trees when you're in the middle of it, and you're just trying to treat patients and take care of them and kind of put out the fires. But you look forward into this year and ongoing from just a 10,000 foot perspective of clinical care and the healthcare industry. What are kind of your predictions for what we'll see going forward and what changes will happen based on what we've learned over the last year?
Yeah, I think we have learned a lot about not only patient behavior, but also provider behavior and how healthcare delivery will happen in the future. So I think telemedicine is here to stay. It may not have as large a footprint in the future as it does currently, but I think in some shape or form, every healthcare system will have to embrace telemedicine. Because the patients have spoken, they want it, and providers have spoken. And it has actually had some really rewarding consequences where, people, for example, we set up telemedicine into our county jail. And these were populations that typically would need an escort and would have to come in to see a specialist. And now we can beam in the specialist into where they are. And the satisfaction on both ends, from the provider side and the patient side, has been tremendous. I don't think we are going to go back to the old way anymore. So those are some of the systems that are here to stay.
Yeah, I think it's fantastic. I mean, we've had a couple conversations, and just hearing all the different things you guys are doing to really, from an on-the-ground level, understand what patients need and really have that great standard of care for them and really take care of that community you guys are trying to serve, I think is fantastic. For folks that want to learn more about Hennepin or maybe talk to you, they hear some things on this that you guys are doing and maybe want to share some ideas, where's the best place for folks to reach out and learn more about your organization or connect with you directly?
Well, I think our website would be an awesome way to connect, hennepinhealthcare.org. They could reach out via the website. All our key contacts and our administrator roles are listed there. I would be happy to answer any questions anyone has. I would also be very interested in like-minded organizations who are working in the space of health equity to reach out so we can have some shared learnings and shared insights around solving the health equity problem.
No, that's great. Deepti, thanks so much for coming on and sharing your story. I think it's awesome. We appreciate all the stuff you guys are doing out there. And like I said, give a big thanks to the rest of your team. And thanks for joining us this morning.
Thank you, Jeff. This was an awesome opportunity. Thank you.
You got it. Thank you. Hey, and thank you guys for joining as well. If you liked interviews like the one today with Deepti, you can catch more on our website at auditmax.com, or you can find us wherever you find your favorite podcast. Thanks. We'll talk to you soon.